if we can't finish this discussion today, we will continue next time. All right. But then I want to ask this question on your behalf because a lot of persons are used to just self-medicating and doing a lot of things, all right, to get well. And I don't know if that is correct. I don't know if that is good. Some persons will tell you, or they don't treat themselves. They just feel, well, he come now, he go still go by himself and all of that. Uh, or some will resort to this traditional healing method. Then some persons will say, ask my pharmacist, he knows what is good for this my headache. I buy drugs from him almost every time, and all of that. So, doctor, I just want you to let's have this as a background to what we want to discuss today. What would you first of all?
I think this is a very wonderful platform to discuss this. When it comes to self medication, this is a practice that is very rampant in Nigeria, and there are many factors that can attribute to this. First and foremost, you have the economic implications of healthcare. When people are ill, they have problems going to the hospital, paying bills, paying for consultation, going for tests before they now get to treat themselves. So they find the easy way out, which is, let's just get the medication that we need. Let's go to a nearby pharmacy. The pharmacist is expected to know about these conditions and should know what treatment will be appropriate. But the truth is, for you to get a good diagnosis, there are some processes, medical history, taking a detailed medical history, going for relevant investigations, which may include your blood work or even some imaging like x-rays or ultrasound or whatever, and checking, for some important signs and symptoms that you may have that would help in the diagnosis. So if you skip the medical history aspect, you skip the physical examination, you skip your lab investigations, and you want to jump on the treatment, you can be rest assured you are not going to get the right diagnosis. So whatever. Why would you do trial and error on your health? Your health is something that is too important and too precious to toy with. So I would advise that practice that we have, we need to have a change of mind and a reorientation regarding that. We need to learn to go and see the right professionals who would evaluate us properly, make an accurate diagnosis so that our treatment can be right. We should always keep in mind that a wrong diagnosis will never produce a good outcome. Virtually every kind of system in your body, you have the digestive system, you can have a digestive infection, you can have a respiratory infection, you can have a urinary tract infection, you can have a central nervous system infection. So you can have infection anywhere. So when you have an infection, how did you even come across that diagnosis? So when somebody says they are treating infection and it's not a doctor that told you have an infection, I'm worried in the first instance because how did you get that fact? Maybe your symptoms may indicate that you have something like that, but you still need a doctor to evaluate you for you to conclusively say this is the type of infection I have and know the type of failure. And nobody can explain how it came to be, especially very young people. So it's very important that you have a clear idea of what you are doing at every point in time and you are guided by a professional. So if you think you have any of these symptoms, please go to the hospital, get evaluated, run the relevant tests. Let your results or reports be interpreted by a doctor and let the doctor give you the right recommendation and adhere strictly to whatever the recommendations are. And you'll find out that you would always have a good outcome than you just trying some random mixtures that you think has worked for one person and has no and will probably not work for you. And you don't even know what allergic reaction you can have to an unknown substance. Because at the end of the day, if you do have a reaction, either an allergic reaction or some other kind of reaction to whatever you have taken, by not knowing what the components are, they rush you to the hospital. The doctor is even at a loss at what to do to you because he doesn't even know what you consumed. But if you consume anything the doctor knows, a known medication, we know the antidote to give you to help you. Causative organism, and then you have lymphatic obstruction. So that causes the fat limbs and the skin of the legs look thick like the skin of an elephant. So it's very important that you know what your diagnosis is. You know what it is precisely so that the doctor can give you the right regimen of treatment that you need. Because all these things we have listed, how would you know that it's from a liver problem or from a kidney problem or from hypertension? Is in heart failure, the person can also have pedal edema.
Okay.
So, but of course, pedal edema would not be the only symptom. So it's with other factors like or other symptoms like breathlessness, cough, problem lying flat, easy fatigability. All those things can point to a
Can
cardiac
can,
problem.
can elephantiasis be treated? You said yes. Now,
Yes, because there are
what if
medications for it.
what if you don't discover it in time?
Well, if you don't discover it on time, then you have major lymphatic obstruction, and then you now have the limbs, enlarged the way we typically know it to be. But you always know, like for every condition, early intervention would always produce good outcomes for you. So the earlier you start your treatment, things don't get worse. You don't get things complicated. Help. That is one thing we need to emphasize to Nigerians. You don't need to collapse or be on the ground or be gasping before you know it's time to go to the hospital. Anything unusual you notice about your health, anything new you notice about your health, go and get it evaluated.
That thing is prone. Everybody, malaria, typhoid, malaria.
Yeah, but we need to correct something that malaria and typhoid are not twins. It's only in Nigeria that we believe I'm treating malaria and typhoid. Everybody just thinks malaria can't even exist alone. It must always be.
No, but but there's this belief that once you have malaria, you must treat with typhoid.
Exactly. So
So are you saying it's wrong? It's not it.
It is a very false belief, because if we look at the etiology or the cause of the two conditions, they're completely different. Malaria is caused by the bites from the Anopheles mosquito that transmits the Plasmodium protozoan into your blood, and then it has its life cycle in the liver and in the red cell. Just assume that they come together. We are not saying that they cannot occur together in some cases, but the way people always say malaria and typhoid, and they now treat it routinely, then it becomes abuse of antibiotics. Because a lot of people, apparently, when they go to test, they find out that it's only malaria they have. They don't even have typhoid, but they keep using antibiotics, and this leads to antibiotic resistance. This leads to you disrupting the normal gut. Because if you don't get a good control of your blood pressure, retinopathy or going blind, you're at risk of having a heart attack or cardiomyopathy. You're at risk of having peripheral vascular disease. There are all sorts of things that can happen to you, and you don't want to experience those things. But why are you running away from medications that you have tried before and it kept your blood pressure and blood sugar under control? Then somebody from somewhere tells you, no, please stop taking those medications, and then try this our new medication. Who you don't even know who else has ever taken that medication. All you're hearing are testimonials.
The 24, is it 24 or
24 HOURS.
okay?
MEDICARE.
Just one word.
Yeah.
24 hours Medicare.
Yes. You can.
Medi is MEDI care.
Care.
All right. 24 hours Medicare. Please, I want everyone to go and follow Doctor right now. Yeah, follow him. Make him phone day too heavy for him this morning. 24 hours Medicare. Please go there, follow